So I'm here with Dr. Carroll, who's the winner of the Depaul Lifetime Achievement Award for 2026, and we're so delighted that you were our keynote speaker today. You really your inspirational work over the years. Talk about the context, Austin, of where you've worked and how you've worked, and how important has that been for you?
I think the key issue is the context. I see context as the life of a person. So, in other words, if I'm dealing with a person's health, if I'm dealing with a person's addiction, I can't deal with that unless I understand their context, where they came from. So if I'm trying to persuade them to stop smoking, I need to understand, why are they smoking? Are they a young woman who's got kids at home and the only way she gets a break is smoking? Are they a person who's homeless who is not bothered about living many years? He just wants to survive the next year, so he smokes because that helps him manage the anxiety. It's about, if someone's got asthma or has got diabetes, if I'm treating them, it's not just about giving them the medication, it's about understanding how do they manage that diabetes in their lives. When they're living in a hospital, how do they store their medication, as simple as that. But how do they deal with the reality of being a diabetic who's also got addiction issues, and which do they prioritise, getting the heroin or getting the insulin? Because often they prioritise the heroin. So context is key. It's no big deal. You need to understand people to be able to work with people. And in health, in medicine, it isn't about just understanding disease. We're working with people, not isolated diseases.
In your speech today, what really resonated with me was the joy of the inner city and the joy of the people in the inner city, but also as well the huge human tragedy that population and community has experienced. How important is that recognition of trauma within communities important in the work that you do?
I love the inner city. I've loved it since I started working when I was 18. And part of what I love about it is I love the humour, the fun, but I also love the rawness. And that rawness is the fact that people in the inner city have experienced huge trauma. I don't think you can work with someone who is in a marginalised community, who's experiencing homelessness, who's experiencing addiction, who's a migrant, unless you understand the impact of trauma, because it determines how they interact with me, it determines their various behaviours, it determines their addiction behaviours, it determines their health behaviours. And when you understand trauma, you understand why they've got to where they have. Without an understanding of trauma, it's too easy just to say, they're helpless, they're weak, they're bad people. Once you understand how they have ended up where they are because of the huge trauma, you can't but just respect and work with that trauma. So,
that recognition within yourself, and the impact that it has on you as well, is important, isn't it?
Oh yeah. So I think, to me, once you understand trauma, you can't hold stigma, because understanding trauma, you understand that this person is using drugs to heal the pain that they are feeling, the shame, the anger, because of the trauma they had as a child. Once you understand addictions like that, you can't see them as bad people who are acting recklessly or weak. So you can only see them as people who are suffering from the impact of trauma. Also, when you understand trauma, it basically gives you insights that hugely improve your ability to help someone, because you know you have to work with the impact of that trauma, and often it means helping people understand that they have had trauma and the impact of that trauma, and that by understanding that, it gives them the skills and the ability to overcome whatever they need to do to achieve good health.
I've one more question for you, and I suppose you've been through a lot, you've established a lot. What one key thing would you say needs to happen next in order to be able to alleviate the challenges that we're facing from a health perspective in this country?
I think the one key thing is that people need to understand that in addiction, homelessness, all these are caused by poverty. Okay, and unless we as a society recognise people aren't weak or reckless or degenerates. They're people who are surviving the impact of a society we have created. And if we are here, like I'm providing healthcare to homelessness, while homelessness is just exploding. So, you know, society needs to address health. It's not just health inequality, but inequality. That's the really big thing we need to do. I know it's big picture stuff, but that's the impact.